Hello, Mrs. Jones. Am I talking to Mrs. Jones, mother of Dylan?
Yes, doctor.
Hello, Mrs. Jones. I am Dr. Yamna, one of the baby doctors working in hospital. So today we have gathered in this office because you had some concerns about the condition of your son Dylan.
Yes,
Am I
doctor.
right?
Yes, doctor.
Okay. So please, can you before we start, can you tell me how Dylan is doing right now?
Doctor Dylan is having puffy eyes for last 3 days, and I'm quite
Right.
worried
Right.
about him, and that's why I came here.
Okay, Mrs. Jillian, I know this is a tough time for you. Can you please express your concerns to me so that I may be able to address them?
Doctor, you know that Dylan was diagnosed with nephrotic syndrome 2 years back, and he
Yeah, yeah.
had relapses uh, in last 2 years, and I'm a bit worried that this may be his another relapse, but I'm
Yes,
not sure.
Mrs. Jones, I see. Yes, Mrs. Jones, I see that you are a very keen mother and you are very smart. Yes, this is a relapse. Whenever, because Dylan is diagnosed with a condition called nephrotic syndrome. I believe you have heard of this syndrome, this condition, nephrotic syndrome.
Yes, doctor, when he was initially diagnosed with this condition, the doctor explained to me about it. But can you again explain it to
Okay.
me briefly?
Yes, sure, Mrs. Jones. You see, our kidneys, they have these small channels which filter all the urine and the waste things that come out in our urine. So you see, whenever there is some swelling of these channels because of any reason, these channels they don't do their work properly, and besides the waste substances, all the good proteins in our body, they also get wasted through urine. That's what happens with Dylan. That whenever there is some infection or trigger, his kidney swelling it goes up, and the kidneys start losing proteins, and that's why he gets so puffy. Are you following me, Mrs. Jones?
Okay. So, doctor, you mean to say that again he is having this condition?
Yes, Mrs. Jones, you are very right. In some cases, like with Dylan, there is this problem happens with minor illness or some trigger, the disease comes back, and that is what's happening with Dylan. So we have to give him medicine for it to get better. Are you following me?
Doctor, yes, doctor, I'm following you. But why this condition keep on coming back again and again instead of
Uh,
giving treatment?
yes, you see,
In spite of
yes,
giving
you see.
treatment, what I mean to say.
Uh, yeah, I understand, Mrs. Jones, and I see that you have very good questions. You see, this swelling of kidneys, it happens because our body has some produces some chemicals which start to fight against kidneys. And whenever Dylan have some minor throat infection or some other bug in his body, and his body's immune system, defense system, it gets activated, it starts producing those chemicals, and besides killing those bugs, they again start attacking on his kidneys. Do you understand what I'm saying?
It is difficult for me to understand, doctor.
Yes, I know this is a big worrisome thing for you. So let me make it more clear for you. You see, our body it produces some chemicals to fight all the bugs. This is our defense system, and whenever we get infection, this defense system system helps to protect our body. And in case like nephrotic syndrome, this defense system starts attacking our own cells like kidney cells, and that's why the kidneys get swelling and they get those damages which cause loss of protein. So
Okay, doctor.
that's why Dylan is having this again and again. Are you
Doctor, for
clear now?
how long Dylan will keep on having these relapses?
This is very difficult to predict, Mrs. Jones, but I will consult with a pediatric nephrologist and give you a better answer for that. Is that okay for you?
Okay, doctor. So when you will let me know?
As soon as possible, I will set up another meeting with you as soon as I get all the
Three
answers from
minutes.
the kidney doctor. Okay.
So, doctor,
Mrs.
for how long?
Jones, do you have any other concern?
Yes, doctor.
Yes, yes,
For
Mrs.
how
Jones.
long? So, doctor, I would like to know for how long Dylan will be on treatment this time.
Okay, so the good thing with these relapses is that the treatment duration is very short. You see, the dose that we have started him on now, he will have to continue this dose until the urine protein test comes out negative for 3 consecutive days. And then we will decrease this dose and we will give him on alternate days for 4 weeks. So you see, roughly he will have to take this treatment for like 5 to 6 weeks at least.
So, doctor, don't you think that giving steroids again and again will cause harm to my child?
You see, for treating any problem, we have to weigh both benefits and harms of that medicine. And yes, every medicine has their own side effects, and the corticosteroids they do have their side effects. But we have, like I said, in Dylan's case, this is the best medicine that we can give to Dylan because it has the minimum side effects and it can
Okay.
cause cure very easily.
Okay, doctor.
And do you have any other concerns, Mrs. Jones?
No, doctor.
Okay, so I think I've given you a lot of information. So would you, if you don't mind, shall I summarize it for you?
Yeah, sure, doctor.
Okay, so Dylan has a condition called nephrotic syndrome in which there is a swelling on his kidneys that is causing the kidneys to lose all the good proteins from his body. And this is since this is the third time he is having this attack in past 2 years, so we have again started him on medicine called tablet prednisolone, and we will continue it in the same dose till he has normal protein levels in his urine, and then we will gradually decrease the dose and plan to give it for another 4 weeks and then taper it over 3 weeks. Is it okay for you, Miss? And yes, you do have some concerns about the duration of illness. For that, I will consult with pediatric kidney doctor, and I will try to set up a meeting with you as soon as possible after it. Is this okay with you, Mrs. Jones?
Okay, doctor. Time is over, Dr.
Hello.
Yumna. Yes, Dr.
Okay.
Yumna. Would you like to give yourself feedback?
Uh, yes, I think I made the description too lengthy about nephrotic syndrome.
Okay. So you started with uh, introducing yourself, and then you didn't establish rapport with me, isn't it?
Yes, yes,
And then you
yes, yes.
immediately, at that time, was in a hurry to know what my concerns are. Okay, so don't do like this.
Yes.
Okay.
Okay.
And when I asked you about nephrotic syndrome, you explained it to me a bit more in detail that was not needed. So instead of that, you should have told me that what
Oh,
happens in nephrotic syndrome is that our kidney becomes leaky and it leaks a lot of protein. Okay, and this protein comes out of the body in pee. And it's because of this that Dylan is having puffy eyes. Okay, so not more than
okay.
that is needed.
Right.
You can explain it in your own words also,
Right.
maybe some other way of explaining it, but don't go into uh, detail. Okay. And then I ask
Okay.
you for how long these relapses keep on coming. So for that, you can say that. Uh, so your first reply was good. That for how long uh, these relapses will keep on coming. That we are actually not sure of. But I would like to reassure you that as child that usually child outgrow of this problem as they age. Okay,
Okay.
okay. And so
Right.
see, there is no need to mention pediatric nephrologist because this answer we know.
Okay.
Okay. And then I ask you that about steroids, that every time you keep on giving steroids and steroids have a lot of side effects. So the explanation which you gave it to me, I was not very happy with the explanation. So instead of that,
Okay.
you should have told me that yes, I understand your concern about steroids, and yes, they do have side effects. But at the same time, I would like to tell you that that steroids are a, is in fact the best treatment that is available for kids with nephrotic syndrome, and we have to give it.
Okay.
But we always try to give it in a minimum dose for a minimum duration, and
Okay.
its we do monitor its drawbacks regularly. Okay.
Okay. Right.
So, I just wanted to ask you something. Since this child has already had three relapses in 2 years, like if it is more than two in a single calendar year, we can think of steroid sparing drugs, but for that we will have to again refer you to a pediatric nephrologist. Can it be answered like this?
Dr. Tanushi, you're not very much audible. Can you
Am I audible now?
can you use your Bluetooth?
Bluetooth. Okay, okay, 1 second. Am I audible now?
Yes.
Okay, what I wanted to say is like the child has already had three relapses in 2 years, and if there's a in one single calendar, if there's more than two relapse, we could think of some steroid sparing drugs. But can we say like that we will have to refer you to a pediatric nephrologist for if there are more than two
Act,
relapses in a year, something like that.
ac- See, actually, what I asked her was for how long he will keep on having these relapses.
No, no,
So
I'm
for how long he will keep on having these relapses? We actually don't know, na?
no, no, that
But
is not the
but
question. I
uh,
was thinking of the other question about the mother's concern about repeatedly giving steroid courses. Don't you think giving steroid will harm my child? That was one of the questions of the role player. So the answer to that, can we also say that yes, I understand your concern, and there are side effects of steroid, and if the number of relapses are more than two in a single calendar year, we can consider some steroid sparing drugs as well, but we will have to do so in with consultation with a pediatric nephrologist or something like that. Can this be an
don't
answer?
don't mention. But if don't mention details, okay. So instead of that, if she kept on insisting about steroid side effect, Then you say that, okay, as I can see that you are quite bothered about starting with the steroids. So what I'll do is that I will arrange your meeting with children kidney doctor, and maybe he will give you mm, uh, o- other options besides the steroids if
Okay, so if she's
they are
insistent,
if they are available.
okay, so the mother needs to be more insistent on that, and very some mothers who are very
See,
adamant that
don't see what we usually do. What we usually do, if child is responsive to steroid, it was already given in the scenario. If you have read
he
that
is
in
responsive
previous
to steroid.
relapses, he responded well to steroid treatment. Okay,
Yeah, that's what.
okay. So it was written actually. So in
Oh,
exam, when you read the scenario, keep on writing important keywords because you will be using those keywords in the exam. So here we won't be telling mother about other medicines that are available. I think we are done with today's session. If any one of you have any queries or questions, then you can ask me. Okay.